Who should get a pediatric urology care? What is pediatric urology? Pediatric urology is the study of the kidneys, ureters, the bladder, the external genital like penis and the urethra of children right from the stage of the child being in the womb to adulthood. A urologist who does pediatric urology has committed himself to see these children right through their childhood and also to the adulthood. Which children will need pediatric urology care? Number one, any child who has a swelling of the kidney, which can be identified right from the child is in the womb, would need a pediatric urology care. Then we look at when the child is born. Once the child is born, once the kidney swelling is there, we would like to see how the kidney is behaving over a period of time. Third important scenario where children will need pediatric urology care is children who have a myelomeningocele or spinal cord problems. This can be there from birth. Even the spinal cord problems, once they are corrected, ultimately the child may end up in kidney failure. That is because the bladder does not work properly. And because the bladder does not work properly, the whole pressures are transmitted to the kidneys. And these children actually need a long-term care. They do have incontinence or they pass urine without their knowledge. They pass motion without their knowledge. And these children, they can be corrected. They can be made socially acceptable so that they don't leak urine and they don't leak or feces. Another place where pediatric urology is needed is in case of male children where the testis is not descended into both their scrotums. It could be one side, it could be both sides. One thing I would emphasize here is generally these testes have to be operated and they have to be brought down between 9 to 12 months of age, and anything beyond 18 months of age, this testis would lose its fertility potential. So the best time to do it is around 9 and 12 months of age, not before, because some of these testes can come down by 9 to 12 months. So we do wait for that time and there wouldn't be any harm for this testis. The other area where the pediatric urologist is of extreme importance is called hypospadias or epispadias, or where the natural passage of urine is not at the tip of the penis. It could be either below or above. It would be in an abnormal position, and this can also happen rarely in a girl child. So all these areas would need appropriate correction, and hypospadias we would like to correct sometime around 6 months to 1 year of age, because the higher the age, the higher the complication rates. This may not be done in one stage, so if you need a 2 or 3 stage surgeries based on the complexity of the issue, then we would look at that the surgical correction should be over by the time of 2.5 to 3 years where the child goes to the school. Now, where does the pediatric nephrology come in the whole gamut of this? The most important area where the pediatric nephrologist would come in would be only when there is hypertension or the child is having increased BP, or if both the kidneys are having kidney failure, or there are some other medical conditions, but primarily conditions which are found out right from birth and in the womb. The bladder conditions and the long-term follow-ups are with the pediatric urologist. In case there is a kidney failure, which we all look at how to prevent that, in spite of all our efforts, if there is some kidney failure or there is increase in BP, then the nephrologist would come into play in these kinds of situations. Thank you.
Like, comment, and subscribe for more health updates.